Maples. I'm joined here today by family members of Maples residents Larry Baillie and Alex Henry, and my colleague Wab Kinew and Uzoma Asagwara. We are here today to respond to devastating situation at the Maples personal care home, which is in my constituency. For many weeks, I have been hearing from constituents who are gravely worried about their loved ones at Maples personal care home. We are here today to demand the government take immediate and decisive action to save the lives and the seniors and the other living with dementia. What I'm hearing from the people calling me, there's a measure announced by the government today. People want to know why these measures weren't announced earlier. Why didn't we learn anything from Quebec? Why didn't we learn anything from Ontario? These measures should have been in place. So I would like to hand it over to Bob to speak more about what action and the government need to take. Thank you.
Very well said. Good afternoon, folks. I want to begin by thanking the families of residents at Maples Personal Care Home for joining us here today. I want to extend on behalf of our team with the Manitoba NDP our sincere condolences to those family and friends who have lost loved ones to the COVID-19 pandemic generally, but also specifically over the past 48 hours at the Maples Personal Care Home. We are here today to stand in solidarity and to show our support for family members whose loved ones we could still save, who, if we take strong and decisive action on behalf of, we may be able to ensure that they make it through this very difficult period. So I want to let people across Manitoba who are anxious and worried let you know that we feel the exact same way. I watched the announcement yesterday with my family, and I told my sons, if you ever see something like that happening, you have to stand up and you have to speak out about it. So that's what we're here today to do. I also want to send my sincere message of solidarity to all the healthcare workers out there. We know that you are tired, we know that you are stressed, we know that you feel that you need so much more in the way of resources and support, and we are here to lend you our full commitment to getting those things on your behalf. We are celebrating Veterans Week right now. Today is National Aboriginal Veterans Day, in which we honor the veterans who fought great battles both overseas and right here at home. And of course, we are looking ahead to Remembrance Day on Wednesday. Now, I have a great, profound love and respect for those who served in our armed forces, and that's why what I'm about to say I do not take lightly. The provincial government must call in the military to help stabilize the situation at the personal care homes in Manitoba. Most urgently at Maples Personal Care Home and at Parkview Personal Care Home. But as we get through this pandemic together, there may be a need for further deployment than that. So to be clear, we are asking for the provincial government to immediately take control of Maples and Parkview, and at the same time, with the utmost of speed and agility, that they also call in the Canadian Armed Forces to operate those facilities while they're being run by the province. Now, this is a strong and decisive action that we can take to save the lives of seniors, including family members related to some of the people that we see here today. There is no downside to this action. What would be the downside of having too much health care available to seniors? What would be the downside of having too much logistical capability on hand to help stabilize the situation in what is clearly a crisis? What would be the downside in having the transparency that the Canadian Armed Forces would bring? We saw in Ontario that they produced very damning reports of the personal care homes, long-term care homes that they were active in. And based on what we're hearing, so many unanswered questions from families, so many remaining questions for those in positions of power, including at the company that runs these facilities, I think we can all agree that transparency is urgently needed. We need strong action today to save lives, but we also need to have answers to some very important questions. The time for baby steps is over. We need strong and decisive action to save the lives of seniors, and that's why we are asking for the Canadian military to be brought in to help us stabilize this situation. Again, we could stand here and we could debate all of the little detailed steps that need to happen, that the current staffing ratio is insufficient, especially during a pandemic, that the amount of nursing hours that go into that staffing ratio is also insufficient, that the report that was conducted on an inspection last Monday ought to be released. We could dive into the details and get into the weeds on all of these subjects, but let's be clear. Right now we need strong and decisive action. The military must be called in today. The province must take over the Rivera homes that are in crisis right now. And so that's what we're calling on the province to do. At the end of the day, we don't want another senior to have to go through those things that have so tormented us just hearing about them this weekend. Imagine how difficult it would be to actually have to live through that, or to find out that your loved one had to endure that. We are a rich country. We are a strong country. Nobody should be dying this way in Manitoba. Nobody should be dying from lack of care in Canada. So we have to act. Any further delay is inexcusable. So at this time, I want to turn things over, and we'll have Larry and Alex share a few.